So for the next drug, which we'll discuss its pharmacology, we'll get to talk about what is known as Arbekacin. Alright, so pharmacology of Arbekacin. So for this Arbekacin drug, you could actually see the chemical structure right here. It's not a commonly used drug, okay? So even to get its picture, it was actually a struggle. Okay, so Arbekacin, we see that it's a semisynthetic aminoglycoside. So it's derived from what? Dibekacin. So it's primarily used to treat multi-resistant bacterial infections. That you came across an infection that you are giving some drugs, is resisting and all of that, So especially Staphylococcus aureus that is resistant to methicillin. Okay, so how it works is it will bind to 30S and 16S ribosomal subunits. So the whole story there is it will now induce some incorrect amino acids into the growing sequence of the proteins. Do you understand? So this will now lead to the bacteria is having proteins, but the proteins are non-functional. So ultimately, the bacteria has to die. All right. So administration is intravenous or intramuscular. Absorption is rapid after parenteral administration. Distribution, good tissue penetration. Metabolism is through the liver, but it's minimal. Excretion is mainly through the urine. So half-life is 2 to 3 hours. So spectrum of activity, mainly gram positive. For the gram negative, it can be effective against infections caused by Pseudomonas aeruginosa, Acinetobacter baumannii, Enterococcus species. Okay, so adverse events, it can be toxic to the kidneys, can be toxic to the ears. At the site where you actually injected it, you can have pain and swellings. Okay, other ones, you can have fever, rashes, and liver enzymes that are actually becoming elevated. Right, so multidrug-resistant gram-negative infections, methicillin-resistant Staphylococcus aureus infections. Okay, so they can also be used with beta lactams, basically just to bring about much more effects.